Today we have Winnie. She is a 2-month-old female who was brought in by mom and dad for her 2-month well baby check. Winnie was born on March 17th, 2026. She weighed 3,640 grams and she measured 53 centimeters in length. She received the standard newborn care and immunizations. Mom denies any illnesses or hospitalizations between her last visit and today. Mom reports that Winnie is cooing. She is able to hold her head upright when being held up, and she smiles reflexively at this point. She reports that Winnie is feeding every 2 to 3 hours. She is solely breastfed. She is stooling about 5 times per day. She has yellow, seedy stools, and she has about 8 wet diapers per day. Mom denies any issues with breastfeeding or latching on. She also denies any issues with nipple cracking or breast tenderness or breast redness or swelling, abnormal swelling. So I'm going to go ahead and proceed with the physical examination. Today, Winnie weighs 6 kilograms and she measures 60 centimeters in length, which is normal growth for her age, and she's in the 50th percentile. And her vital signs are temperature of 37.4 degrees Celsius and O2 sat 99%. We're going to go ahead and start with looking at Winnie's head, and we're just looking for symmetry, make sure that there's no hematomas or rashes on her scalp, and there are none from this point of view here. We're also going to measure her head circumference. And her head circumference measures 38 centimeters, which is normal. And she's in the 50th percentile for her age group. I'm also looking at Winnie's ears, and they are symmetrical. They're not too low set. I'm looking at the outside of her ears. She's got the normal helix curvatures, and there's no rashes, no redness, no drainage, and none in the postauricular areas as well. I'm looking at Winnie's eyes. They're not too wide set. I'm going to assess her pupils. And her pupils are round, equal reactive to light. I'm also looking at Winnie's nose, and it's symmetric. There's no rash on the skin of her nose, and her mouth, her mucous membranes and her lips look pink and moist. I'm going to examine her sucking reflex, but first I'm going to stroke with gloved hands the cheek on either side and elicit the rooting reflex, which is still intact in Winnie. And so with a gloved finger, I will insert a finger into her mouth, and she has a very strong sucking reflex. I don't notice any abnormalities to the soft or the hard palate. I'm also looking at Winnie's neck, and I don't see any rash or lesions. I'm going to palpate her clavicles, and they do feel and look symmetric. So now I'm going to look at Winnie's chest and abdomen. I don't see any rashes or lesions on the skin of her chest or abdomen. And I'm also going to listen to her heart and lungs. And after listening for 60 seconds, Winnie's heart rate is 110 beats per minute at this time, which is normal for her age group. I did not hear any gallops, rubs, or murmurs. She has a regular rate and rhythm. Now I'm going to listen to her lungs. And she has normal vesicular and bronchovesicular breath sounds bilaterally, and no increased work of breathing. And so now I'm going to listen to her abdomen. And she has normal bowel sounds. I'm also going to palpate the abdomen and check for any abnormal pulsations or organomegaly. So I'm just going to do it gently. And I don't feel anything abnormal, no organomegaly. And she doesn't have any, she didn't cry excessively when I was doing the abdominal exam. So now I'm going to check her extremities. I'm checking her arms and legs for joint stiffness or laxity. I'm also looking at her hands, and she has 5 fingers on each hand, and no rashes on the skin, no erythema or ecchymosis, and in flexing her shoulder, there's no rigidity. Her elbow, there's no rigidity, there's no laxity, and her hand. I'm also going to test the palmar grasp uh, reflex here, and it is still intact. And so I'm doing the same for the left side. There's no rigidity, no laxity in her joints. She has normal tone, and there is some resistance. And again, the palmar grasp reflex is intact. And then I'm also assessing for the pulses. And so I'm checking her brachial pulse here. And she has 2+ brachial pulses. Okay, and so I'm doing the same for the lower extremities. I'm looking to see if there's any erythema, any ecchymosis, any abrasions or rashes, and there are none. And so I'm checking her range of motion. I'm doing passive range of motion here, and there's no ankle clonus. And then I'm also going to check for her pulses, femoral pulses. She has 2+ femoral pulses. I'm also going to check for hip dysplasia, and I can do either Ortolani or Barlow's maneuver. So if I abduct her thighs, I don't feel any click or dislocation in her hips. Or if I flex her thighs and her knees towards her body and press downward gently, I don't feel any dislocation. I don't hear any clicks. And there's no rigidity in her joints, and there's no laxity either. There's good tone and good resistance when I move her legs. I'm also going to check for deep tendon reflexes. I'm checking the brachial, and it's a +2. I'm checking the patellar, and I'm checking for her Achilles. And in checking other reflexes, I'm also going to check the plantar grasp. And so when I put my finger on her underneath her toes, they curl inward. I'm also going to check the moral reflex. So I'll grab her, I'll take hold of her hands here and support her. Pull her to a sitting position, support her head, and then when I release, she should extend her arms and then bring them back in. And she did. That's normal for her age group as well. We're going to check her head strength. So when I hold her upright, she's able to hold her head upright. And then when I place her feet on the table, she's moving her feet as if she were taking steps. This is checking the stepping reflex. I'm also now going to look at her back and then check her gallant reflex, which is still intact. And then at this time, I'm going to look at the back of the scalp and her skin on the back. And there's no rashes, there's no lesions, there's no ecchymosis or hematomas. I don't see any Mongolian spots or any other discoloration. I'm also checking the extremity skin from the posterior aspect, and there's nothing abnormal. I could take this time and put Winnie on her belly, and she is able to hold her head up off the table and a little bit of her shoulders, which is normal for this age group. And so now we'll just go ahead and place Winnie back in mom's arms, and we'll discuss the plan of care. For Winnie, she will continue to breastfeed as long as there is no issues with breastfeeding, and she can do that. As you know, she requests to eat every 2 to 3 hours is normal. We're going to make sure to discuss to place Winnie on her back to sleep. Swaddling is not as recommended at this age group because there's more motion, and we don't want her to have the blanket, move or migrate up to her face. So layering of her clothing to be warm is a good idea, or a blanket that's not going to be easily wrapped around her face. Always place her back to sleep. And then also, we're going to discuss, the importance of car seats, and they do have one. We're going to discuss immunizations for this visit, which are necessary. And for Winnie today, she would have to have her second dose of hepatitis B, her first dose of DTaP, her first dose of Hib, and first dose of polio, as well as PCV. And we'll discuss what she can do if Winnie has a reaction to a vaccine. She'll get handouts about the vaccines and where to report the reaction, as well as next steps depending on the type of reaction that Winnie has. Although it's not likely, it's good information to share. And we're going to discuss when Winnie should come back, which is in 2 months for her 4-month well baby visit, as well as things to expect as she grows and develops, and when she can start eating solid foods, which would be appropriate at about 6 months. Or eating more, things like cereals, softer foods, but more than breast milk. And we're going to go ahead and make sure that if there's any questions the parents have, we can answer them at this time. Thank you.